It basically started from birth. Generally, right, when we're born and our teeth start to come in, it's the first two bottom ones that come up. So in my case, one of the two went sideways. So that's been an issue for me most of my life. My teeth were never really that good. And both my parents really both of them had trouble with their teeth. They both struggled throughout their lives with their teeth. So I'm going to attribute some of this to genetics, I would imagine.
Thomas was actually one of the most difficult cases I've ever seen. He had implants that were put in, a couple of years back that were all infected. He had infections all throughout his mouth. He had an infected bicuspid that basically went across his chin and basically blew out the entire bone for the most part of his chin. So, we knew we had to do something about it. We had to take those teeth out, and what we were going to find underneath it was just a surprise.
I had no molars, so I wasn't chewing or eating with my teeth in the back. Everything was pretty much in the front. And I could not eat with the denture because the denture would rock. It was cumbersome. So I would take the denture out and then I would just chew on the bar, the metal bar, and whatever bottom teeth I had, the bridge that I had here, that's how I ate. I was lucky enough not to walk around in pain, obviously. But I did carry that infection around for, I want to say, the better part of a year plus. My body was having a hard time dealing with it, and I was starting to, my lip would blow up, and I was getting all kinds of funky reactions in my mouth. So it was like my body saying, look, dude, you have to do something. You can't just stay like this forever. My challenge was, okay, we could address the issue, but then what happens afterwards? So they have to take everything out. But then what do you replace it with? And that was a big issue for me. I knew I had to go the route of doing it right, properly. But doing it properly is expensive. So I was at a crossroads and I didn't know how I was going to address the issue. We had gone to other doctors, and I could tell you the cost was literally damn near twice as much as what I've been able to do here at Sage.
Somehow, I was able to find the right amount of bone at the right spot, and he was able to go home that day with teeth that didn't come out.
I actually had teeth. He was able to do everything in that one procedure. So he got rid of the infection. He packed bone in the spaces that needed to. He put the implant, he put the posts. So there's the post in the top, there's the post in the bottom, and I can smile. That day, I have teeth with molars. Amazing. This has been the easiest procedure. For as difficult as it was, this has been the easiest for me. Able to breathe again, and smile, and knowing that I'm going to be able to eat again, and it's like your face is back, your persona's back. So it's very cool.